Eric, first of all, thank you so much for joining. I'm really looking forward to the conversation.
Likewise. Thank you for having me.
The conversation I'm having today really means a lot to me because it's a central part of this Modern Team series, and that's accessibility and inclusion. This story starts with the Commonwealth of Virginia during COVID-19 and their effort to set up contact centers to help residents answer questions and address concerns around vaccination, testing, and the latest community guidelines. And this Modern Team we're going to talk about today came together to address a really big challenge, a life and death challenge in many ways, which is how could the deaf and hard of hearing community receive this critical health information and ask and answer questions in a way that best serve their unique needs. So today I get a real privilege to speak with Eric Raff, director at the Virginia Department for the Deaf and Hard of Hearing. Eric was one of the people that identified this issue and tirelessly worked towards a solution. Eric, it is a thrill to get to speak with you today.
Thank you. Yes, thank you.
So Eric, this is Dan speaking. From what I gather when learning about this story is that this starts with an unfortunate but widespread general lack of awareness for the needs of the deaf and hard of hearing community. Could you share more about that gap and the journey you experienced trying to implement these resources in the state during COVID?
Yes. One thing to keep in mind is that hearing loss is an invisible disability. It's not obvious or apparent. If you see someone who's blind, they may have a white cane or a service dog, and you can see that that person is blind. But with hearing loss, people are not fully aware of what the barriers are. The bottom line, though, is it's about communication and access to effective communication. That's where the barriers lie. People don't really seem to understand that fully. There are misconceptions or misunderstandings that are rife out there. It's a challenge because the deaf and hard of hearing community involves a large group of disabilities, part of the larger sensory disabilities. And those groups receive limited funding from the government. Compared with the blind community, they have a small population, but are heavily funded. The deaf and hard of hearing group, by comparison, has limited access to funding. And that's a very strong challenge to getting government services. There are a lot of needs from birth to death, the entire lifespan, from early intervention to aging. There are spaces where it's frustrating for people to access services or language, and that runs the gamut. And that's the challenge that we face all the time.
So let's talk about this moment in during COVID. And one of the things I was inspired by is our team actually identified and trained members of the local deaf and hard of hearing community to work within the contact center as ASL fluent representatives. I wonder if you could share what that experience was like and how people received the request to become representatives. Were people hesitant, perhaps, to be outside their comfort zones, and how you felt as the leader of the organization in seeing these representatives serve their community?
Absolutely, Dan. I am one of the staff who is involved with representatives. My department during COVID we acted as a temporary accessibility center for functional needs. So when the Virginia Department of Health let us know they were setting up a call center to answer questions about COVID, about vaccination and the illness writ large, I thought to myself, well, frequently deaf and hard of hearing people will call through relay. And I'm not sure if these representatives are trained to handle relay calls. It's easier to have direct communication rather than going through a third party. I was reflecting on my experience recently as a consumer. I bought insurance recently. I had done that through a TTY, that's old technology. But when I called direct to my insurance provider and instead of using relay, going through a third party, I found that communication was more effective, eliminating that third party. So thinking about that, with today's technology, consumers are using video phones, where it's a very visual sign language, of course, is a visual language. So it's much easier to communicate and sign for many of these individuals rather than going through an interpreter. So if there's technology where I could call directly and speak to a sign fluent person, whether they are deaf or hearing, and ask questions and get responses in that language, it's certainly clearer and reduces the opportunity for misunderstandings. So that's why we set up the COVID vaccine call center and why we propose that we should set up this direct video phone number. The Virginia Department of Health was willing to establish that. Then they let me know that they were contracting with Deloitte to handle that. So that's how we all began working together. I realized that the technology is more complex than I had bargained for. And at that time, Communication Services for the Deaf, CSD, contacted me and offered their services. I thought, well, that is perfect timing. Because at that time I was negotiating with the Virginia Department of Health and Deloitte. I thought, wow, we already have the knowledge and expertise to establish the technical piece. So when the Communication Services for the Deaf reached out, and the three of us were able to coordinate this establishment of the actual call center, there was a pretty quick turnaround from where we were able to launch and get this off the ground. There was a lot of national attention garnered on us. People reached out to figure out how we had established this direct communication hub. We honestly did not face many barriers in terms of its establishment. The financial piece is an ongoing frustration, of course. And to this day, I'm not entirely sure why, but that was the only challenge that I saw. I wish we could continue the funding for another year to ensure that deaf and hard of hearing people continue to be able to access that information about COVID-19.
You mentioned that you received a lot of national attention, and I believe it's because Virginia was a leader in being inclusive of the deaf and hard of hearing communities and in bringing together the public sector, the private sector with Deloitte, the nonprofit, as you described. How would you recommend other public and private institutions, as they're facing their own challenges, become more inclusive of the deaf and hard of hearing communities?
Well, another state There was another state agency for the deaf of hard of hearing, and I would, so we have this here in Virginia. We have the Virginia Department for the Deaf and Hard of Hearing. Maybe in Massachusetts, you may have the Massachusetts Commission, or there may be an office of the deaf and hard of hearing. So the way that states organize these state agencies is various. I would recommend that people start with their state agency, though, because tapping into that network can prove invaluable. There's also national agencies for the deaf and hard of hearing. So you can work with those organizations on kind of a global level. There is a website that you can look at and see all the different agencies that could assist you. I would also say, that this was a wonderful partnership within the three sectors, the government, the private, and the nonprofit. It was really a perfect, just carpe diem moment where we were all able to come together and the stars aligned.
Well, I love carpe diem moments, and that's a wonderful image to put in our audience's mind. I'd like to close with a personal question. Just as you reflect on this accomplishment that, as you said, was a carpe diem moment, and that was done very quickly from the time this great team came together, how does that feel, and what does it teach you about the potential going forward if these sectors come together more consistently?
It's always about 99% effort, 1% timing. You really have to continue to make the effort to do what you need to be doing to provide this public service, removing the barriers. Building relationships with various people is also an important part of this, whether that be other government agencies, private sector businesses, or nonprofits. As you network, you can identify strengths and weaknesses and understand what those entities have to offer. In that, you can pool your resources and capitalize on each other's strengths. Maybe I lack something that you can offer me, and vice versa. It's always about continuity and continuing to look at the environment and understand where you're working.
Eric, it's been an immense privilege, not just to spend time with you today, but to partner with you in creating the kind of impact that we made together. Thanks for your service.
Well, thank you, Deloitte, for working with us. It's been a wonderful opportunity, and I so appreciate the time that we've been able to spend with your staff. It's been a wonderful experience. I feel I've got new friends, new relationships with you.
Wonderful. Okay, now let's bring in my colleague, Casey Martner. Casey's a contact center transformation leader at Deloitte. Casey's been working with Eric and his colleagues to roll this program out in an incredible pace, in an incredible moment in our history. Casey, it's great to have you here today.
Thank you, Dan. It's great to be here.
So Casey, briefly, could you give an overview of your work at Deloitte related to contact center transformation? Because perhaps some of our audience may not know exactly what that means and the importance of it throughout society.
Of course. Within our digital contact center or contact center transformation offering, we work with our clients to design, build, operate, or optimize either existing or brand new contact centers. Often our focus is, just like in this situation, on increasing access to services, In others, it can be on reducing costs, shifting to newer technologies like the cloud from legacy on-premise solutions, or adapting to the new remote working environment that we're all working in. Always, those efforts have at their foundation work to improve the human experience, which in this situation includes both the end users or the customers, as well as the experience that the agents have working within these environments. I think it's important because the volume of inquiries that contact centers through any different channel, but still largely through voice, is consistently increasing. And in many circumstances, contact centers are an organization's main kind of direct engagement with their customers. In a lot of processes, the only option to complete those steps to acquire services. I focus specifically within our government work and with many different state and federal agencies. And in situations like COVID in the Commonwealth of Virginia, as well as in other states, contact centers are critical to get that information out to their constituents or residents. And even more so in other situations where we support helping refugees come to the United States, disaster victims, or even some of our deployed service members.
Love it. So, Casey, let's talk specific to this moment in Virginia and to the solution that you and the team collaboratively built with Eric and his team. How is it different than other work you've done previously, and were there specific things you needed to keep in mind, challenges you faced as you constructed this solution?
Of course. I would start on a personal note. I'm a resident of Virginia myself, and in that sense, this project was very different for me in that I was helping members of my own community and could see the impact of what was happening just as I walked around and talked to neighbors or people in other settings. And especially an opportunity to do something, I would say, so unique in supporting members of the deaf and hard of hearing community. And I think Eric may have mentioned this, the first of its kind in these kind of COVID contact centers was important. Eric also mentioned something that I think is specific to this solution and this environment, in that during 2021, everything was turned upside down. Typically, in a lot of projects or engagements, the questions are on what's the budget, what's the schedule, how does this change the requirements, and you have cumbersome approval or authorization processes. In this environment, the questions always were, how many people can we reach? How fast can we do it? What do we need to get it done? And so when Eric raised this solution to the Secretary of Health and others within the Commonwealth government, the questions quickly became, how can we serve this community and how can we get this done by next week? So the stars really did align from a leadership perspective to remove any barriers contractually or budget-wise to get this implemented. I think the challenges beyond that internally with our own team was just as you had noted on how to incorporate ASL agents into our typical operations. The environment was highly dynamic. Things were changing every day at this time with policies from the federal government, new tools, vaccine availability. And we largely were very verbal in how we worked with the team. Often pulling everyone into a Zoom room and just discussing what the changes were here. This really caused us to be more deliberate and focused on how we could be inclusive and share information with our ASL agents. I think some of the other big challenges were really more external. Eric and this partnership that came to put the solution in place really worked to help this piece of the process and improve access at the contact center. And a member of the deaf or hard of hearing community could speak with one of our agents, get information, and make an appointment to get a vaccine. But then the question was, well, what happened when that community member went to the clinic? Was there an interpreter at the clinic? How would they acquire services there? And it was a struggle for us to work with a lot of endpoints or kind of last mile operators to understand what was going on there, or to let them know that they had this type of community member who was coming to visit them. And I think highlighted really some of the challenge of an end-to-end solution is needed.
Casey, I want to close by asking you how this experience changed you and your worldview personally. I mean, you and I and our entire team at Deloitte believe deeply in the power of accessible and inclusive teams. And yet I'd imagine that your view on how we at Deloitte and we in society can be more broadly accessible and be more broadly inclusive has evolved as a result of this experience. I'd love to hear about it.
Oh, definitely. This has been a huge eye-opener for me personally. Eric spoke to this as well, but often in contact centers, there is a requirement to be able to support members of the deaf and hard of hearing community. And we typically in the past have said, well, we have the ability to use a teletypewriter or a TTY device. And as I now know, those are really legacy tools that aren't widely used. And this community has shifted to video phones and leveraging a third-party interpreter to interact with people to acquire services. And just as Eric noted that this condition is invisible, that meant within our contact centers that these customers were also invisible to us. We didn't know when they were interacting with us. We weren't able to track these types of interactions, perform QA, and work to continuously improve them. And so that was a big learning point for me, of that we really do need to be kind of intentional and understand how we're incorporating different designs within our projects, within our solutions for members of different communities. And this particular type of solution has now become something we advocate for in every design that we do. But it's really become a question of, it's great that we're designing this new automation or voice bot, chat bot, or other types of tools that we see kind of marketed, but there are challenges with everyone getting the same level of support using those, such as members of the deaf or hard of hearing community, or as Eric also mentioned, members of the blind community. So it's kind of forced us to be much more intentional in how we work to find kind of equity within our designs. It's also been eye-opening that sometimes we just need to speak or listen to particular members of these communities, because the solutions aren't necessarily technically complex or even cost prohibitive. You just need to know that they exist and work to incorporate them in what you're doing. So I think that has been the lesson that I've taken to heart here, is to step back and really just think about what we're doing with respect to how members of different communities will be able to actually access or use it.
Beautifully said, Casey. And I'm not sure there's been a better example of a modern team than the team in Virginia, who rose to meet the moment in one of the nation's most complicated, challenging times, and rose to meet it in an inclusive way that considered the needs and the nuances of all parts of our community. A huge thanks to Eric for his leadership, Casey as a terrific colleague, and a special thanks today to Emily for being a terrific interpreter.
Thank you, Dan.